Welcome to the lecture on heart. Before going to study about the heart, you should know what is the meaning of pericardium. Peri means around and the cardium means heart. So the pericardium is the structure around the heart. Pericardium is fibroserous sac which encloses the heart and roots of the great vessels and situated in the middle mediastinum. There are two layers of the pericardium, the outer fibrous layer and inner serous layer. The serous layer of the pericardium has two layers, parietal layer and the visceral layer. The visceral layer is also known as the epicardium. In this picture, you can clearly see the fibrous pericardium and the serous pericardium. The outermost layer of the pericardium is called as fibrous pericardium, and inner layer of the pericardium is the serous layer. The serous layer has two layers, parietal and visceral layer. In between these two layers, there is a potential space called as pericardial cavity, which filled with serous fluid called as pericardial fluid. The fibrous pericardium is conical shaped structure, and the apex of the fibrous pericardium is located at the level of sternal angle and fused with roots of the great vessels. And base of fibrous pericardium blended with central tendon of the diaphragm. Anteriorly, pericardium is related to sternopericardial ligaments, third to sixth costal cartilages, and also anterior borders of the lung. Posteriorly, pericardium is related to esophagus, main bronchi, descending thoracic aorta, and T5 to T8 vertebrae. On each side, there are roots of lungs and phrenic nerves. In this picture, the dotted lines show the arrangement of fibrous pericardium, which encloses the roots of the great vessels and also the central tendon of diaphragm. As I mentioned earlier, the pericardium related posteriorly to descending thoracic aorta, esophagus, on each side, both lungs and also phrenic nerves. Serous pericardium is thinner than fibrous pericardium and it has two layers as I mentioned earlier. The pericardial cavity, you should know what is the function of pericardial fluid as well as the clinical importance of this pericardial cavity. Pericardial sac, you should know there are important sinuses called transverse sinus and oblique sinus. These are the pericardial reflections of visceral layer of the pericardium. In posterior wall of the pericardial sac, you can see there are two tubes called as arterial tube and venous tube. Arterial tube is enclosed the great arteries of the heart, and venous tube encloses the great veins. In between these two tubes, there is a sinus called transverse sinus. In this picture, you can see the transverse sinus and the oblique pericardial sinus, which is located on the posterior surface of the heart, and anteriorly it is related to the left atrium and posteriorly related to pericardium. In this picture, you can see the transverse sinus of the pericardium. And also this diagram clearly shows the arrangement of arterial tubes, and the relation of transverse and oblique sinus to the left atrium. So let's discuss about the heart. Heart is conical shaped structure placed obliquely in the middle mediastinum, and it has four chambers, two atria and two ventricles. There are grooves and sulci in the heart and borders and surfaces. I think you should have some knowledge about surface anatomy of heart. So, I'm not going to tell about that again. And what is the location of apex of the heart? Apex is entirely formed by the left ventricle and it directed downwards, forwards and to the left. Apex of the heart is situated at left fifth intercostal space just medial to the midclavicular line. So this is in this picture you can see the location of the apex. It is in fifth intercostal space just medial to the midclavicular line. So this is the apex, and the base of heart, also called as posterior surface of the heart, which is mainly formed by the left atrium and small part by the right atrium. So this is the base, mainly formed by the left atrium and small part by the right atrium. There are four borders of the heart: upper border, inferior border or lower border, right and left border. Upper border of the heart, it is slightly oblique line and formed mainly by the left atrium. Right border of the heart is vertically placed and formed by the right atrium. The left border of the heart, somewhat oblique and curved, formed mainly by the left ventricle and small part by left auricle. Inferior border of the heart is horizontal line, mainly formed by right ventricle and small part by left ventricle and right atrium. So this is the upper border of the heart, lower border, left and right border of the heart. In this picture also clearly seen that also there are 5 surfaces of the heart including the base. Anterior surface is formed mainly by the right ventricle and small part by right atrium. Inferior surface, also known as diaphragmatic surface, which rests on the central tendon of the diaphragm. Left two-thirds of the inferior surface is formed by the left ventricle and right one-third of inferior surface is formed by right ventricle. Left surface of the heart is formed by left ventricle and also left auricle. Let's discuss about the structure of the heart. Heart has 4 chambers, 2 atria and 2 ventricles. The right atrium, which receives blood from superior vena cava, inferior vena cava, coronary sinus and anterior cardiac vein, venae cordis minimi. Venae cordis minimi are small venous structures in the heart. Upper end prolonged to the left. and form right auricle, and margins are notched, and interior is sponge-like structure which prevents free flow of blood. Right atrium has a shallow vertical groove which extends from superior vena cava above to inferior vena cava below, and interiorly it forms the structure called crista terminalis. The sulcus terminalis produce internal muscular ridge. It is crista terminalis. This picture you can see the crista terminalis, which is the internal muscular ridge of sulcus terminalis, which extends from superior vena cava above and inferior vena cava below. Interior structure of the heart, right atrium, it has smooth and rough part. The posterior part is smooth and anterior part including the auricle is rough part. The smooth posterior part, most tributaries are open into this part, and the coronary sinus open in between inferior vena cava and right atrioventricular orifice. This is the structure of the heart. The groove called as crista terminalis, which is the internal muscular ridge of sulcus terminalis, extends from superior vena cava to inferior vena cava. And the right atrium has rough anterior part and smooth posterior part. Most of the tributaries of the heart opens into that smooth posterior part of the right atrium. In rough anterior part, including the auricle region, there are transverse muscular ridges called as pectinate muscles. These are extended from crista terminalis towards the atrioventricular orifice, like a teeth of a comb appearance. In the auricle, these pectinate muscles form reticular network. In this picture, you can see the pectinate muscles. You can see the pectinate muscles. Interatrial septum, which derived from septum primum and septum secundum embryologically. It has a shallow depression called as fossa ovalis, which is the embryological origin of septum primum. And the annulus ovalis or limbus fossa ovalis is the prominent margin of the fossa ovalis. So this is the fossa ovalis, and the margin of the fossa ovalis is called as annulus ovalis or limbus fossa ovalis. Let's discuss about the right ventricle. Right ventricle is somewhat triangular in shape, and interiorly it also has smooth part and rough part. The rough part is also called as inflow tract. Rough is due to trabecular carniae, and also it has a moderator band, also called as septomarginal trabeculae, which extend from ventricular septum to base of the anterior papillary muscle. Important thing of the moderator band is the right branch of the atrioventricular bundle of the conduction system traverse through this moderator band. This inflow tract also has papillary muscles. There are three papillary muscles: anterior, posterior and septal, and also chorda tendinae. In this picture you can see the chorda tendinae which extends from the papillary muscle to valve. Outflow tract of the right ventricle is smooth and infundibular ventricular crest is located near this outflow tract. This is the interior structure of the right ventricle. You can see the inflow tract. Inflow tract means the rough part, and outflow tract is the smooth part. The upper part of the interventricular septum has thin membranous layer, and lower part is thick muscular. Lower part of the interventricular septum has thick muscular layer. The thin membranous part of interventricular septum separates two ventricles and right atrium and left ventricle, and lower thick muscular part of interventricular septum separates two ventricles. Left atrium, it is in quadrangular shape, and interiorly it also has smooth and rough part. The greater part of the left atrium is smooth and auricular part is rough. For pulmonary veins, vena cordis minimi opened into the left atrium. This is the structure of the left atrium. It also has rough part and smooth part. For pulmonary veins open into the left atrium. The left ventricle, which receives oxygenated blood, and interiorly it also has rough and smooth part. Rough part is due to trabecular carneae, and smooth upper part. Left ventricle, which receives oxygenated blood, and interiorly it also has rough and smooth part. Rough is due to trabecular carneae, and left ventricle has two orifices. Papillary muscle, and also there are papillary muscles, two papillary muscles in the left ventricle, anterior and posterior, and walls of the ventricle is 3 times thicker than right ventricle. This is the structure of the left ventricle. There are two papillary muscles, posterior and anterior papillary muscles. These papillary muscles connected to the heart valves through the chorda tendinae. There are 4 valves in the heart: tricuspid, which is in between right atrium and right ventricle; mitral valve, in between the left ventricle and the left atrium; and also semilunar valves. There are 2 semilunar valves, aortic and pulmonary valve, and also there is a rudimentary valve which is nearby the coronary sinus. These valves need to maintain unidirectional flow of blood. So these are the 4 main valves of the heart. Bicuspid valve, it has 2 cusps, and tricuspid valve has 3 cusps. The semilunar valves, aortic and pulmonary valves, have 3 cusps. Let's discuss about the blood supply of the heart. Blood supply to the heart is from right and left coronary arteries. Both coronary arteries arise from aortic sinuses. Aortic sinuses, there are aortic sinuses are situated near the cusps of aortic valves. The right coronary artery started from anterior aortic sinus and runs forwards between the pulmonary trunk and the right atrium, descend in the right atrioventricular groove and reach the inferior border, then along the atrioventricular groove and come to the posterior interventricular groove. Lastly, anastomose with the left coronary arterial branch. It gives marginal branch and posterior interventricular branch, which is along the posterior interventricular groove, and anastomose with anterior interventricular branch. Let's draw the diagram of blood supply to the heart. Left coronary artery, it is it is larger than right coronary artery and started from left posterior aortic sinus and go behind the pulmonary trunk, left to the pulmonary, then come to the left to the pulmonary trunk and go along the left atrioventricular groove and runs around the left border of the heart and gives circumflex artery. And left coronary artery then continue as anterior interventricular artery along the interventricular groove. The sinoatrial node of the heart is usually supplied by right coronary artery, but one-third of subjects the blood supply to the SA node is given by the left coronary artery. So in this diagram you can see the right and left coronary artery. This is another picture of right and left coronary artery. And the venous drainage of the heart. Bulk of venous drainage by veins which accompany the arteries and open into right atrium. Rest by small cardiac veins, also called as venae cordis minimi. These veins directly open into the cardiac cavity. Coronary sinus is the largest vein of the heart. It lies in the posterior atrioventricular groove and opens into the right atrium. It has few tributaries: great cardiac vein, middle cardiac vein, small cardiac vein, and oblique vein. This is the venous drainage of the heart, and let's draw the diagram of venous drainage of the heart. This picture you can see great cardiac vein, posterior cardiac vein, middle cardiac vein, and small cardiac vein which open into the coronary sinus. Nerve supply of the heart. Heart has sympathetic and parasympathetic nerve supply. Parasympathetic is given by the vagus and sympathetic nerve supply is given by cervical and upper 5 thoracic sympathetic ganglia as well as superficial and deep cardiac plexuses. The conduction system of the heart. Let's draw the diagram of conduction system of Let's discuss about the conduction system of the heart. The cardiac conduction system is a group of specialized cardiac muscle cells in the wall of the heart that send signals to the heart muscles causing it to contract. The main components of the cardiac conduction system are sinoatrial node, or SA node, it also called as anatomical pacemaker, which starts the sequence by causing the atrial muscles to contract, and the atrioventricular node or AV node, bundle branches and Purkinje fibers. The sinoatrial node of the heart is located at upper part of the crista terminalis, just right to the superior vena cava opening. An AV node or atrioventricular node is situated in the atrial septum above the opening of coronary sinus. An atrioventricular bundle of his conduct impulses into the ventricles and divides into two branches at the junction of membranous and muscular part of interventricular groove, and then divides into small branches called as Purkinje fibers.